The class is on antihistamines. So, 1 minute. Something is obstructing. Okay. So this histamine, as you know, it is a tissue amine and it is stored mainly in the mast cells as well as in the blood. It will be in the basophils. The tissues rich in histamine, it will be skin, gastric and intestinal mucosa as well as lungs and liver and placenta. And you have already studied it is synthesized from the amino acid histidine. So that is about histamine and some more points. So, you know, whenever there is some allergic reaction, what is happening? There is an immunological release of histamine as well as chemical release. And so what happens in immunological release? So whenever there is an antigen, when we are exposed to some antigen, some pollens or something, some allergen, so what will happen? There will be the antibodies are formed and it is on the surface of the this master cells. It will be attached to the IgE receptor. And so first time there will be formation of IgE antibody. Next time when we are again exposed to the antigen, so this antigen will bind to these antibodies. So one antigen to two antibodies, IgE antibodies, and it is attached to the master cells. And when this is attached, there will be degranulation of the master cell, and there will be formation of lot of histamine. So degranulation of the master cell occurs and the formation of histamine, and other cytokines are also there, but we are talking about the histamine. So there will be degranulation. And there is another release by chemical and mechanical release. Here, when there is some mechanical injury to the master cell, that also causes the degranulation of master cell as well as the histamine release. Then there are histamine receptors. There are 4 types of receptors. There is H1, H2, H3, and H4. So we will be dealing with the H1 antagonist. H3 receptor, it is an autoreceptor for autoreceptor. You know what is autoreceptor? When it is stimulated, it will inhibit or control the release of histamine. So that is the meaning of autoreceptor. The autoreceptor of any neurotransmitter, when it is stimulated, that will inhibit the release or control the release of that particular transmitter. Here it is the mediator, that is the histamine. Then now just we will have a look on the pharmacology. So we will have a look on the pharmacological actions. So here, first we will see the actions of histamine. Later on, we will see the our drugs, that is antihistamine. So you know that in blood vessels, it causes dilatation of the smaller blood vessels. There will be dilatation. So histamine, just in an allergy, there will be redness, swelling, etc. So this is because of the dilatation of smaller blood vessels, but larger arteries will be constricted by histamine. That is number 1. Then triple response. You have already studied what is triple response. It is Lewis triple response. There will be flush, flare, and wheal. And the flush, it is because of the capillary dilatation. Flare, it is because of the arteriolar dilatation. Wheal, that is edema. It is the so that is everything. It is caused by histamine. So that is called triple response. Then the effect of heart, histamine on heart, there will be rate as well as contraction will be increased. Visceral smooth muscle, you know, there will be histamine. It causes bronchoconstriction. And abdominal cramps, that is intestinal contraction, and that causes colic pain. Glands, it causes increased gastric secretion. So first we will have just a look on the histamine action. That is why we are going like this. Then sensory nerve ending. So histamine will stimulate the sensory nerve. That is why when we have some allergy, there will be itching, burning sensation, etc. Then autonomic ganglion and adrenal medulla, there will be increased release of adrenaline. CNS, this alertness is mainly, it is one of the mediator for alertness. We won't sleep off. So that is histamine. We will see when we come to antihistamine, we will see what is happening. Then there is another product called beta histine. It is a histamine analog. It is not antihistamine, it is a histamine analog. But this is mainly used in case of vertigo. So one drug, that is beta histine. Now we will come to our drugs, that is H1 antagonist. That is the histamine, antihistamines that is acting on H1 receptors, that is H1 antagonist. This H1 antagonist, it will be antagonizing the actions of histamine in the H1 receptors. And first H1 antagonist was discovered introduced in 1930, and later on the other drugs, less sedating, non-sedating second generation antihistamines were added after 1980. So it is very recent, 1980. So this is the classification. Just we have a look on this. It is in your book, it is written. Anyway, just have a look. There are different types: highly sedative, moderately sedative, and mild sedative. And the drugs are highly sedative: diphenhydramine, dimenhydrinate, promethazine, hydroxyzine. I don't know whether you have heard of this drug, Benadryl. Cough syrup is there, drug is there, Phenergan syrup is there. It is the trade name. Then moderately sedative phenyramine, Avil tablet, I think you will be familiar with. Then cyproheptadine, meclozine, cinnarizine. Cinnarizine is nothing but stugeron. I don't know whether you are aware of that. Then mild sedative, it is chlorpheniramine, dexchlorpheniramine, triprolidine, and clemastine. So these are all sedative. First generation antihistamine drugs, that is the older one. So it was highly sedative. They are all sedative drugs. And the second, SGA means second generation antihistamine. SGA, second generation antihistamine, that many drugs are there: fexofenadine, loratadine, desloratadine, cetirizine, levocetirizine, acylastine, mesolastine, ibastine, rupatadine. So out of this, I think you'd have heard of fexofenadine, cetirizine, levocetirizine, I think. So the drug name will be Allegra, or cetirizine, it is Allerid, levocetirizine, levocet. Many drug names are there, trade names are there. I have taken only one or two, the commonly used one. So this is the second generation antihistamine. So now we will see the different actions and pharmacokinetics. So pharmacological actions, we have seen that this histamine, it causes bronchoconstriction. So antagonism of histamine, there will be bronchodilation. Then contraction of intestine and other smooth muscle, that is dilatation. So contraction produced by histamine, that is everything that is happened by the histamine, it will be antagonized. And the triple response also, it will go off. Larger blood vessels, actually histamine causes contraction. So this will be antagonized. There will be dilatation. So that is one action. Then anti-allergic, this is what is called urticaria. You know that, urticaria. And this is angioedema. Angioedema means there will be swelling in the skin and subcutaneous tissue mainly. So this is in the edema of the eye. Sometimes it may happen here. So that is angioedema. So this is also can be, this is by antihistamines. But in asthma, we cannot use, it's not useful. We will come to that point, why antihistamines are not useful in asthma. Asthma is also an allergy condition, but antihistamines are not practically used. Okay, then CNS. This older one, I told you, it causes, histamine is mainly for the alertness. So antihistamines, it will cause CNS depression and sedation. So older ones mainly produce CNS depression and because it penetrates the blood-brain barrier. So that causes the sedation. Then anticholinergic action. So because of the, it will block the muscarinic actions of acetylcholine, and all the anticholinergic effect will be there. We will see that. Then local anesthetic effect, that is a membrane stabilizing effect is also there. The first generation, older one like phenyramine, promethazine, and diphenhydramine, they can be used as the local anesthetic. When we take this Avil tablet or other phenyramine tablet, chlorpheniramine, etc., phenyramine, etc., we will be having dryness of mouth, etc. So, and there will be secretions, all the mucosal secretions. If you are taking for allergic rhinitis, all the secretions will dry up. So this is because of the anticholinergic action, so antimuscarinic action. Then BP fall can occur because there will be smooth muscle relaxation, and also some drugs are having alpha adrenergic blockade, especially promethazine. So there will be BP fall. Now, pharmacokinetics, you know that all these drugs, Avil tablet, cetirizine, levocetirizine, etc., can be taken orally, and also there are parenteral injections are also there. And the older ones, as I have already told, it will penetrate the brain, but the newer ones, they won't. Now coming to side effects, again the repetition. So it is only mild, and the number one side effect, it is actually sedation. So there will be lack of concentration, then fatigue will be there, always tendency to fall asleep. So that is the one side effect. So these people who are on, so sometimes people will be drivers, they will be having allergic rhinitis, and if we are prescribing antihistamine, we have to tell them that they should not drive vehicle, operate motor vehicles, because this needs more constant attention. So the person may sleep off. So they have to be careful. Don't operate the motor vehicles. And also because of the CNS depression, it is not advisable. The antihistamines are not advisable in children. And also it may interfere with the learning and academic task because they will be sleeping. That is the reason. Then anticholinergic property, again, repetition. So there will be a dryness of mouth, alteration of bowel movement, urinary hesitancy, blurring of vision. These are all anticholinergic side effects that also will be there. Then epigastric distress and headache also will be there. It's this is very rare. So that was about the older one, or the first generation antihistamines. Now coming to the second generation antihistaminics. This is the most important. This is clinically also it is important. For your exam wise also it is very important. Second generation antihistaminic may be asked as a short note, or each drug may be asked as a short note, or in any form. This second generation antihistaminics can be asked for the university exam. At least one question will be there from second generation antihistamines. So this is actually marketed after 1980. So some important points for the second generation antihistamines, it doesn't have any CNS depressant property. So that means there is no sedation. It is highly H1 selective, and there is no anticholinergic side effects. So no CNS depressant effect, no anticholinergic. And apart from that, it will block the histamine also, and there is also a late phase allergic reactions, the leukotrienes, platelet activity factor, and other cytokines. That release also, it will also inhibit that. So this second generation antihistamines, these are the important properties of this. We'll again come to that. Then, because it does not cross the blood-brain barrier, it won't impair the psychomotor performance. And for driving, it is not contraindicated, but some patients do complain of sedation, even though it is told it is non-sedating. Some people, even I have taken, I was sedated. So we can say it is non-sedative, but some people, some patients do complain of sedation. That is second generation antihistamines. I am talking about levocetirizine. Now, the indication, you know, the allergic rhinitis, then conjunctivitis, you are all familiar with that, the rhinitis, conjunctivitis, then hay fever, urticaria I have already shown, dermographism. Dermographism means these patients, because their skin is so allergic, so sensitive, if you write something, if you write your name, that name will be displayed. So like this. So this is dermographism. So such condition, we can use this second generation antihistamines. Even others also, but this can be, because of the less side effect, it can be used. Then acute allergic reactions to drugs and foods. Second generation antihistamines, but they have only poor antipruritic, antiemetic, and antitussive actions. Then we will come to one or two drugs, important drugs. Fexofenadine, it is commonly used. This is very safe drug. So this is actually the active metabolite of terfenadine. But about terfenadine, This was the first non-sedating second generation antihistamine, but after taking that, several deaths of people because of the Torsades de pointes, that is called polymorphic ventricular tachycardia, because this caused the blockade of delayed rectifier potassium channels in the heart. That led to Torsades de pointes, and it was withdrawn, terfenadine. But later on, they found out another drug which is called fexofenadine. It is the active metabolite of terfenadine. And this fexofenadine, it is doesn't cause any this polymorphic ventricular tachycardia or Torsades de pointes. It is the commonly used nowadays for almost all allergic conditions. We are using fexofenadine. We are using cetirizine also. Fexofenadine, it is safer. Then astimizole is another second generation antihistamine. Some more point about fexofenadine. So I told you it won't cause any blockage of delayed rectifier potassium channels, and so there is no prolongation of the QTC interval, and Torsades de pointes is not produced. So there is no, it is free of arrhythmogenic potential, and it will penetrate the blood-brain barrier poorly because it belongs to second generation antihistamine, so it won't produce any sedation. Even if it produces, it will be only very mild compared to the older antihistamines. Free of, there is no anticholinergic side effect. Oral absorption also, it is rapid. So these are about fexofenadine. Then loratadine, another drug second generation, but one important point you have to remember, seizures are reported. So fexofenadine, it is a better choice. Then our cetirizine, levocetirizine or cetirizine. So about cetirizine, this is another commonly used drug. It is metabolite of hydroxyzine. Again, it belongs to second generation antihistamine. So sedation will be mild. So it penetrates the brain poorly, mild sedation, not prolong the cardiac action potential or no arrhythmia. Cetirizine also inhibits the release of histamine. I told you some second generation antihistamines, it inhibits the release of histamine also. Then this cetirizine, it has a high concentration, it will be in the skin. So it is used in case of this atopic dermatitis. You would have seen such cases. So because of the high concentration in the skin, the cetirizine is useful in case of atopic dermatitis. Now another enantiomer of cetirizine, it is levocetirizine. It is safer than cetirizine, and it is effective at half the dose. It is compared to cetirizine, again, very less sedation only. It belongs to second generation non-sedative antihistamine, but I told you some sedations may be there. So it is having only very less sedation. So that is levocetirizine. Then the other drugs are acylastine. Again, the second generation, it is available as nasal spray also. Then misolastine, ibastine, then rupatadine. Rupatadine, it is having platelet activating factor antagonistic property. So these are all second generation. So out of this, fexofenadine, cetirizine, and levocetirizine, these are the most important. Now coming to uses, already you know the uses, but the number one, I am talking about the uses of antihistamines, the allergic disorders. But this antihistamines, it give only the symptomatic or palliative, this one. It won't suppress the antigen antibody reactions. So it will block only the effects of the released histamine. It won't suppress the antigen antibody reaction, but the histamine that is released, it will be inhibited. And you know, this histamine, most of the allergic anaphylactic reaction, there will be a lot of histamine will be produced. And adrenaline, it is the physiological antagonist of histamine. So this may be one question for your Viva also. The physiological antagonist of histamine, it is adrenaline. Then in the beginning, I was telling these antihistamines are ineffective in bronchial asthma. So another question for your exam. What is why antihistamines are ineffective in bronchial asthma? This is because two important points. One, leukotrienes like LTC4 and D4 and platelet activating factors. They are the most important mediators in humans than histamine. In bronchial asthma, these are the important factors that is liberated in bronchial asthma. So our antihistamines we can use, but it is ineffective. Then another thing, number two, in the site of the bronchi, at the bronchi, the histamines that are liberated, it will be very huge amount. So our this antihistamines, it cannot block the actions of the huge amount of histamine that is released. So because of these 2 points, so one is leukotrienes, PAF, etc. are important in bronchial asthma. Second, the high concentration of histamine. And the antihistamines cannot block all the histamine that is released locally in the bronchi. So because of these 2 reasons, antihistamines are ineffective in bronchial asthma. Then these antihistamines are also useful in the insect bite. We are all familiar with that, IV poisoning. Then abnormal dermographism, I have shown you. Then blood or saline infusion-induced rigor. So you would have seen in the clinics after starting IV infusion, patient may start develop chills and rigor. So for that reason, for that them also we can give this antihistamines, so it will be stopped. Then for pruritus, antipruritic action, but the older one it will be useful. Second generation antihistamines, they are having less antipruritic action. Then common cold, again, because of the anticholinergic, because cold there will be running nose, there will be flow of water. So because of the anticholinergic action, it can suppress the common cold, symptomatic relief only. Then motion sickness. So motion sickness, whenever we go for some journey, people may develop some motion sickness, starting giddiness or vomiting, etc. So the drugs that can be used are promethazine or diphenhydramine or dimenhydrinate or meclizine. So this any drug, we can use that. Then we can take, but this drug should be taken 1 hour before starting the journey. So that is used for motion sickness. Then vertigo. Vertigo, it is another class. So I am not going into detail of vertigo. Vertigo means it is a spinning sensation or rotation. So it is not the rotation of the person. It is the people. We feel that our surroundings are rotated. So there is rotation of the surroundings. So that is vertigo. So in vertigo also we can use this antihistamines. Then another drug that is second, the cinnarizine. Cinnarizine, it is a H1. This cinnarizine is another side effect. Sorry, not side effect. It is a short note. Cinnarizine. So some additional properties are there. It is an H1 antihistamine, number 1. It has got weak antimuscarinic action. It is having anti-5-HT action. It is having sedation. So it belongs to first generation or the older generation. Vasodilator property. Vasodilator property, this is because of the calcium channel blockade. So it modulates the calcium fluxes and attenuates the vasoconstriction action of many endogenous mediators. So like means calcium channel blocking property. And it is one of the drugs that is used in vertigo also. In the beginning, I have told another drug, beta histine. It is a histamine analog. So this is another drug, cinnarizine. It is also used as an anti-vertigo drug. So important properties of the cinnarizine, it is an H1 antihistamine, weak antimuscarinic, anti-5-HT, sedative, vasodilator because of the calcium channel blocking property. So that is about cinnarizine. Then again continuing the uses of antihistamines, pre-anesthetic medication. So before anesthesia, starting the anesthesia, we need some anticholinergic sedative action. So for that, we may use this promethazine. Other drugs are also there, but we can use this promethazine. Then cough. In cough also, most of the cough syrup, they will be having this either dimenhydrinate or diphenhydramine, etc. So this is mainly because of the sedative and anticholinergic property. Parkinsonism, we know that we can use centrally acting anticholinergic drugs. In addition, we can use this drug also, anticholinergic drugs, antihistamines, because of the sedation and anticholinergic effect. Then acute muscle dystonia is an extrapyramidal syndrome that is caused by this antipsychotic drugs. So for that also, promethazine, diphenhydramine or hydroxyzine. So I think you would have seen oculogyric crisis. That is it is one of the extrapyramidal syndrome that is caused after antipsychotics. So such cases, we can use this promethazine, diphenhydramine. Immediately it will go off if you are giving this drug. Then these antihistamines are also used as a sedative, hypnotic, anxiolytic. It can be used. It is not a good sedative. It's not a good sedative like our benzodiazepines. So, but for mild cases, we can use as a sedative, hypnotic, and anxiolytic. Some people will be sedated. Their anxiety will go off with just an antihistamine. So I think that is all about H1 antihistamine. So H2 antagonist we have already studied when we studied about peptic ulcer. So some allergy conditions, because this histamine receptors H1, H2, H3, H4 are there. So some cases of allergy conditions, in addition to H1 antagonist, we have to add H2 antagonist also. Then it will be having a good effect because some actions will be happening through H2 antagonist, H2 receptors also. So H2 antagonist, we have already studied symmetrine, ranitidine, famotidine, etc. So we already studied in peptic ulcer. So this can be used along with the H1 antihistamine in certain cases of allergy. Thank you.